Nice chairs.
Am I on?
Testing.
I'm on, right?
Can you hear me? Oh, great.
What's that?
Your new car.
Good morning.
Morning.
Life-changing and life-saving. That's the work of community health centers. And if you didn't know what a community health center is, you're sitting in one today. So thank you for joining us at the Cholla Health Center. Cholla is one of our newest locations for neighborhood outreach access to health. And my name is Wendy Armendariz, CEO for NOAA. This health center facility, as you can see, was a car dealership at one point.
Yeah.
To be a community health center in 2023. Today, our purpose is to talk about protecting Medicaid, and I would be remiss to share with you the impact that that has on our patients and our community. Last weekend, right here at this facility, we hosted our NOAA Fest, which is a big event for the community, and I met Sarah for the first time. Sarah is one of our dear patients that came to this health center specifically to apply for Medicaid. She had tried on her own, was not successful, and someone in the community said, just go to NOAA, they will help you. And so she walked in, she applied for Medicaid, and that day she started behavioral health services. She shared with us that day, over the last year and a half, I have received every single service in this facility. Medical care, behavioral health, pharmacy, nutrition, dental. I am healthy because of this health center. And I am now the caregiver for my veteran father who's on disability, and I'm now helping to take care of him. But if I did not have that coverage and that help from this health center, I would not be here today. And so I thank you for joining us, for supporting, for advocating for Medicaid, because our families and the patients that we serve need it the most. 58% of our patients are on Medicaid, and so for us, that's 27,000 patients that could potentially lose their Medicaid coverage. That is a lot. And we all know when people lose coverage, they end up in the emergency department because they forgo all of their health care. So again, thank you for being such a great advocate, for helping us to make sure we're supporting Medicaid at every level that we can. You are welcome for any tours. We'll be available at the end of the session for tours to share more information about our health center. Again, a big thank you to our members of Congress who are helping us make sure families receive the services and the coverage that they need. And I'll turn it over to January Contreras, Executive Director for Children's Action Alliance.
Thank you to Wendy. Life-saving, life-changing, we know that's what access is. We know that's what Medicaid services are. And so thank you again to everyone who is here today. It will take all of us to help protect Medicaid and other essential services for the people of Arizona. We know how important Medicaid and access are to children and families all over the state, in rural Arizona, to seniors in nursing homes, to people who have 2 part-time jobs but don't have employer insurance, and to kids, especially in this state of Arizona. 1 out of every 3 kids uses access or kids care. So we want to thank our 2 U.S. senators for their leadership, Senator Kelly and Senator Gallego, for bringing us together for this town hall. A little bit about the format. The format of the town hall is really guided by you and your questions. So each of you were asked in advance to provide some questions. Thank you for responding. Those of you who did, some of you will hear me ask your questions to our senators right up here on stage, and others of you will be asked in the audience to take the mic and to ask those questions yourself. I have the privilege of introducing Mark Kelly, our U.S. Senator. Mark Kelly has served his country as a U.S. Navy combat pilot, NASA astronaut, and now as a U.S. Senator for Arizona. He has made us so proud. With his leadership. I'm going to turn it over to the Senator to introduce our other panelists.
Well, good morning, everybody. I've got a few comments to make, but let me just say it's always great to be with Ruben. Combat veteran, Marine. I spent 25 years in the Navy. Ruben spent a long time in the Marine Corps fighting in Iraq. And when you're a Navy guy like me, we love the Marine Corps.
Yeah, we do all the work.
It's good you got in front of me on that. Because for us, the Marine Corps, it's like our own little army. Right, Navy guys? And it's good to see, so it's great to be here with Ruben. We've been now serving together since he got sworn in January. It's great to have a partner on all these things that we work on every single day. A lot of them have to do with veterans. I'm on the Armed Services Committee. Ruben's on the Veterans Affairs Committee. But January, let me just start by saying, and then I'll pass it over to Ruben for some opening comments, that these are challenging times. I think a lot of us in this audience didn't expect what the outcome of the election in November was going to be. I certainly didn't, and I was wrong about that. Elections have consequences, and we're seeing some of the consequences of last year's elections over this last 6 weeks. And it's been kind of hard. So it's important for us to have these conversations with the community, to hear from all of you how this is impacting you, or how do you think it's going to impact you. The thing we're talking about today actually hasn't happened yet. And I wouldn't say it's guaranteed that it will. I would put it on the high probability list, and I want to go into a little bit about what we think might happen. We just got back from 10 weeks in session. It was a pretty long stretch of the United States Senate being in session, dealing with a lot of these issues and a lot of the consequences of the president's executive actions on so many things. But the big thing that's coming up is their attempt, the Republicans' attempt, this president's attempt to extend his giant tax cut for millionaires and billionaires that he did in 2017. So let me explain to you a little bit about how these two things are connected. So that tax cut that they want to extend and maybe even double down on, add to, is very expensive. Trillions and trillions of dollars. At a minimum, we're talking about $6 trillion over 10 years that would be added to the deficit and then to the debt. So $6 trillion is a lot of money. So the reason this Medicaid discussion is even a thing right now is they're trying to make it not look so bad. And here's how they're trying to do this. One is Elon Musk's cuts to the federal government by firing people and canceling USAID, laying off veterans, thousands and thousands of veterans who are now serving their country as government employees. Veterans that Ruben and I have recently met with. I've met with some of them myself, whose lives have been ruined. So they're trying to create some space there by getting rid of government employees. Many of these, most of them, are valuable employees that provide services to all of you. Well, that could maybe add up. Their goal is maybe $1 trillion. They're trying to get another $1 trillion, and that is where the Medicaid, Medicare discussion comes in. They want to cut about $880 billion from Medicaid, Medicare, or both. So that would bring then their $6 trillion number down to $4 trillion, and it doesn't look as bad. But this is, you got to remember, all of this stuff you're hearing every single day is so they can give a big giant tax cut to people who don't need a tax cut. We could raise the taxes of billionaires, and they will still be billionaires. And that's what we should be doing. We shouldn't be gutting these services. When I was elected, I told Arizona that I would stand up for Arizonans in Washington, D.C., and that's what Ruben and I have been doing here. And make no mistake, they're coming after you. They're coming after families, they're coming after veterans, They're coming after people who work at the Department of Education, medical researchers who work at NIH, public health officials at CDC, disaster relief professionals at FEMA, and healthcare workers that work at places like this, federally qualified health centers that provide incredible service to the community. And this isn't just about Medicaid. This is an important part of this discussion. Medicaid is the foundation of our healthcare system in the state of Arizona. You kick 750,000 people off of Medicaid, that means those resources from the federal government aren't going to be here anymore, and that means places like this close down. Or hospitals are going to have to cut staff, and that staff affects the people that aren't on Medicaid or aren't on Medicare. It has an impact on everybody. Now, Medicaid here is called access. And they're going to go at this in a couple different ways. Maybe provide a lot more red tape so people can't get on Medicaid or they can't stay on Medicaid. The other way they're going to do it is just by cutting the match number. And in our state, if that federal match goes from 90% to 80%, almost immediately 750,000 people will get kicked off of Medicaid. And then the money for Medicaid doesn't go to this FQHC, doesn't go to the hospitals that get paid. And they're going to have to start getting rid of the staff that provide health care for all of us. So this has a very broad impact, not just for the folks on Medicaid. So we're going to get to some questions. Ruben's got some opening comments, but I want to really get to the point in doing this. This hasn't happened yet. And it's possible we could prevent it from happening. We have to convince our Republican colleagues that this is a really bad idea, and this really hurts people. And when people don't get their normal health care, they're going to rely on the emergency room, and they're going to get sicker. And ultimately, it winds up being more expensive. We should be doing the opposite of this, trying to figure out ways to make the delivery of Medicaid and Medicare more efficient, but maybe even trying to expand the population when we can so people don't have to rely on the emergency room. And that's how ultimately we can reduce the cost of health care in this country. That and have the resources by raising the taxes of rich people. So with that, let me turn it over to Ruben, and then we're going to take some questions.
Thank you. Thank you, Mark. And it's been great to have a colleague like Mark to really show me the ropes. And I loathe to say it, but sometimes the Navy does lead the way. All right? And happy St. Patrick's Day to everybody. Look, I think what's this administration is trying to do, Trump and other Republicans, they want us to believe that there's only certain ways you could do things, right? And it has to be to an extreme. And I think we have to reject that to begin with. We can be a rich country, but taking care at the same time of the needy. You could be a strong country and at the same time being compassionate. We can be a country that abides and has some really strict laws, but at the same time, we could also be a just country. We can do these things because we're a great country. And great countries can do a lot of things for their people without having this kind of maximalist position. And I think that's what's happening now, is that, the belief that the only way that we can maximize the prosperity of everyone in this country is that we have to take the most vulnerable and cut them even further down. And when I say cut them even further down, these are largely working class Arizonans. These are people that are working probably 2 jobs and have a kid or 2 kids. They don't want to be on Medicaid, let's be clear. If they could afford their own health insurance, they would do that. But they're in the situation where they can't do that. And the best thing that we could do as a state and as a country is to give them some basic care that ends up helping all of us. Because when we kick those people off of Medicaid, their kids, parents, they're going to use the system, but they're going to use it in the most inefficient way possible. And some of us grew up in that world where we didn't go to the doctors all the time. because it was too expensive. And we went finally to the doctor when there was no choice left if we weren't lucky enough to find a place like here. And then what happened? The issue was more serious then, and it was also ends up being more expensive. So you will see these emergency rooms become the primary care doctors. For us that were here many, many moons ago that wrote the Medicaid expansion law, we had that in mind because we knew how bad it was getting. We knew that rural Arizona was going to be hurt first. They're going to shut down hospitals in rural Arizona. So if you're an Arizona resident, you find yourself needing to go to an emergency room, there was a good chance, had we not passed Medicaid expansion, you're going to have to take a helicopter to Maricopa County or Pima County or Flagstaff County, regional county hospitals essentially, right? Imagine you having to drive for hours to see your loved one because you couldn't get basic emergency care. That was a real issue. In rural Arizona, 30% of rural Arizona is on Medicaid, where compared 15% to here. So we can see a future where a lot of rural Arizona is going to be going without and even driving further and further distances. And yes, we're all in the same boat because the hospital that has an X-ray machine and has a CAT scan machine doesn't get to just separate out the costs. So when that hospital can no longer pay as much as they can for that X-ray because Medicaid just got cut, they're going to increase the price somewhere to make up for it. So again, we can do this. We can be a prosperous nation. We can have billionaires. Good on you, become a billionaire. But at the same time, we can take care of the people that make this country work every day, and we certainly don't have to gut them to feed these billionaires again. It is not an either or. There's a lot of things we could do, and they're going to, unfortunately, the math, I'm not as good at math as the shuttle commander here is. Math was very important to him. If he decimal off, the plane goes boom. Marines were a little different, right? But there's no way they can get to those tax cuts without cutting Medicaid. The math doesn't math. That's why we're here. That's why we're having these town halls, because we want you to get enough information for you to go back and talk to your other friends. Talk to your friends that talk to Republicans and have friends that are elected officials, whatever, and tell them this is going to have really bad effects on Arizona. It will be bad for our health. It'll be bad for our economy. Our public sector health, our hospitals, our doctors, they're a big driver of this economy. You will essentially be causing layoffs that are unnecessary. And so we can get a lot of things done together in this country. We don't have to be tearing each other apart, especially to feed some people that just don't need as much help as I think they think they need. So with that, Jerry, I don't know if you want to take questions or como quieras.
Yep, first question's for you.
Oh,
Which you're touching on. I mean, it's clear that the threatened federal cuts to Medicaid, to SNAP, to these essential services will impact our economy overall, as you just spoke to. But starting with where the hurt will be felt first, children and families. What is the potential impact of federal cuts to Medicaid on children and families?
So before the Republicans get to their full plan, they voted on what's called a blueprint of a plan, a resolution. In that resolution, it said that they needed to find $850 billion to cut from this one committee. In that one committee, they basically control two big chunks of money, Medicare and Medicaid. Now, I don't think they're dumb enough to go after Medicare, but I do think they're dumb enough to go after Medicaid. And in order for them to cut $850 billion from a very, very narrow slice, they're going to go deep. See, even the kid agrees. He's very, very concerned, very concerned. They're going to have to go deep. And what does that look like? You're going to go after some of the most vulnerable families that are probably on the edge in between, absolute poverty and poverty, right? So when we expanded Medicaid in this state, we went above the federal poverty level because we knew there were so many working Arizonans that were stuck. They were stuck in between that they're not poor enough to get Medicaid, but not rich enough to actually be able to support themselves and get an affordable health care plan on their own. So this is where we kind of filled that void in Arizona. And that's the first group that'll go. They'll say, well, we're just going to drop that population. Maybe they'll go find healthcare somewhere else. But when you're looking at how many children that'll be, it will be hundreds of thousands of children automatically cut. And you'll see the repercussions almost right away. For some places, for example, I live in South Phoenix. We have a lot of clinics of this nature. They are entirely dependent on Medicaid. They will shut down. And areas like South Phoenix will have people will have to drive further and further away to go see a primary care doctor. You'll see increases in different types of diseases that could be manageable. We have a problem with childhood diabetes here in Arizona, and the best thing you could do to both prevent and also maintain, or at least maintain health-wise, is to make sure that they're seeing constant doctors, getting the therapies that they need, the insulin that they need. You will see increases in those types of diseases. And you will also end up seeing the end result of it at our emergency rooms. Because what happens, for those of us that grew up poor, and I unfortunately was in that community, you will hold off going to the doctor as long as possible because you can't afford it. And when that happens, your problems become harsher and become more complicated to the point where you finally do show up at the doctor, it's going to be even more expensive, potentially deadlier, or you're going to end up in the emergency room, which ends up costing everyone a lot more. That's what's going to happen right away if this occurs.
Thank you. Senator Kelly, Arizona, our elected officials, our voters, we really have a strong record of bipartisan support for healthcare and for access, specifically in Arizona. You touched on this. Part of this is there must be Republican colleagues of yours that are convinced of the importance of Medicaid. What would you say for all the people we have here? What are the most compelling arguments that can convince those officials about the need to preserve Medicaid at its current funding level, right now, where we are, their investment in Arizona and across the country?
Well, I think we can convince some of them, but not all of them. And you're right, here in Arizona and in many places in the country, Medicaid gets strong bipartisan support. It was under Jan Brewer as governor
I negotiated with her.
who negotiated this. Ruben was in the state legislature. My wife, Gabby Giffords, voted on this in the House of Representatives. This was a bipartisan effort to get people the health care that they didn't have that they really needed. I mean, convincing people depends on the person, right? I know there are Republican U.S. senators that are really worried about this. And there's one thing I got to disagree with Ruben on. He said he doesn't think they're dumb enough to go after Medicare. I kind of disagree. I think I think some of them are dumb enough to do that as well.
And then they're evil then enough. There's a difference there if they went after Medicare. Come on.
I think it's possible. And I actually think this is going to be a combination of them trying to hit both programs. As Ruben mentioned, it's what that one committee, Commerce and Energy?
Energy Commerce, yeah.
Energy and Commerce, that is, their portfolio. And that's the only thing that adds up to the $850 to $880 billion that they need. It's one thing for Ruben and I to try to convince our Republican Senate colleagues that are sort of on the fence on this. And they might be on the fence today. But when it comes time for them to vote on this, there will be tremendous pressure on them from the White House, from this president, to pass his number one priority, which is this tax cut for rich people. So it will be a lot of pressure. So how do you create enough pressure on the other side for them to vote against it? Now, that nobody's got to convince Ruben and I, right? But you've got these other senators in other states that are very likely to fall in line. What we can do is you got to stand up and be heard. Coming here is really, really helpful. To come to this event, to ask us some questions about it, to have your voice heard. It's really important. But you got to be talking to people about this. Yes. Your friends and your neighbors, some of you have relatives in other states. Your friends and neighbors have relatives and friends in other states. It's got to be this grassroots upswell of support against this really bad policy. And it's not just this policy.
Veterans.
He's got bad policies on tariffs. I met with some business owners. Governor Whitmer of Michigan was in Tucson yesterday. We went around to some local businesses. Their costs are already going up because of tariffs and the anticipation of more tariffs. So the grassroots anger about bad policy and how it's going to affect Arizonans and people across this country is the thing that can really change the tide on this.
Thank you, Senator.
Trumpflation, that's a good one.
Trump slump.
I thought maybe the king of inflation.
Okay, we have some people in the audience here. You submitted questions, and we want to turn to you to give you a chance to ask your question directly. I think we'll start with Marcos Castillo from Protect Our Care.
Marcos.
Hi, gentlemen. Pleasure meeting both of you. Met Gallegos a couple times. So you have to follow along with my thought process here, so I wrote down my question. When speaking of DEI-A, many people gloss over the A, which is the accessibility part. Do you see the attacks on DEI-A and the cuts that could be coming to Medicaid affecting access to health insurance for those living with disabilities who use the program as part of their toolbox to live a more independent life?
I mean, Marcos, without a doubt, yes. The one thing we've seen is that Trump and his Doge, is that how you say it? Doge? His Doge boys would, my mama taught me better, calm down. They cut arbitrarily sometimes because they just look at line items and they don't understand that there's people behind that. You know, the one thing I've seen being on the VA committee is that some of the cuts to the VA have been just arbitrary, right? They think like, oh, we're just going to cut these programs, it's fine. Like, like, oh, we just cut a bunch of veteran contracts. Well, some of these veteran contracts are really important, for example. They're very important for some of us to get PTSD treatment. For those that are veterans, some of us will also receive treatment outside the clinic for PTSD. And some of those are, independent small contractors that are doing it. They just went and cut those, right? So when it comes to the accessibility portion for our population that uses Medicaid, that could entirely be possible. They could entirely go and start cutting some of these things that they think are unnecessary. Whether it's, for example, it could be just as small as mobility devices, right? And that doesn't sound like a big deal to a lot of people here, but there are varying degrees of mobility devices. Sometimes for you to go to a certain workspace, you need to have certain types of machinery, certain types of mobility, and if they say, well, we're just going to give the basic wheelchair, for example, versus a real mobility device, it's going to affect these people's lives because they're not going to be able to go to stores, they're not going to be able to enjoy life, they're not going to be able to go get work. But for the 21-year-old little San Francisco techno hacker, all he sees is, well, what's the difference between the $120 wheelchair and the $2,000 mobility device? Well, the $2,000 mobility device allows that person to be independent, have pride, hang out with their family, get a job, and continue living the American dream. So this is where there is a danger in that, to be honest, Marcos, and we do have to be aware of that and be on top of it.
Yeah, Marcos, I mean, these are the people that on the DOD website, the historical references to the Enola Gay were taken down because of the word gay, named after the mother of the commander of that airplane, because her first name was Gay. So this is what we're dealing with here. So they don't put a lot of thought into this.
Nope.
So yeah, I think that's at risk. It's important for you to point that out, though. And when we go back to Washington and we're talking to our colleagues about this, we could use that as an example. Are you seriously, in this effort, this DEI effort. You're going to get rid of these resources that folks need to provide accessibility so they can live their lives. So thank you for bringing it up.
That's why they leave off the A.
That's right.
It'll be so much more easier for them without the A.
That's right.
I think that we're doing a terrible job at messaging what DEIA actually is and the expansion of being able to put programs like this exactly into rural communities. I'm from Yuma, Arizona. I moved up here because I wasn't going to be able to be a successful quadriplegic living in a rural community with one hospital, with most of our healthcare having to go across borders, having to find little things that were going to glue our life together. So I had to move out of my community to be able to find those things. And in the previous years, it looked like the Infrastructure Act was going to be able to help us be able to have more accessibility to the programs that we have up here. And now we're starting to see the retrograde of those programs, and I think we're not messaging correctly to tell people what DEIA actually is and what it does for communities like mine that we fight so hard for. So I appreciate you gentlemen continue to fight to the community, because I think that's one of the things that a lot of us on the left get angry about many times, is that we don't fight with the same type of it seems like they fight dirtier, and we're not willing to get in the mud with them. Maybe it's time we start getting a little bit dirtier with our messaging, because
Thank you, Marco.
Thank you, Marcos.
Candy Espino.
Good morning. Thank you for being here. I represent the provider community, the behavioral health provider community here in Arizona. And, we talk a lot about messaging and what messaging is really needed to sway Congress away from cuts to Medicaid. And so I'd be curious, based on your conversations that you've had with your colleagues in Congress, what type of data and what type of storytelling is really going to hit home to help sway them away from, cuts or cost shifting?
Yeah, I'd say real stories about real people that demonstrate what the impact is on them, on their family, on the community here in Arizona. That really matters a lot. You say you come from a behavioral health background. I was on the phone with a woman that lost her son here in Phoenix recently to suicide. He was a veteran, and he was calling the VA hotline on a Saturday to get some mental health services. He wasn't able to get those services. We're trying to actually figure out whether it was related to the cuts that Elon Musk just made to veterans health care, specifically to the suicide hotline. I don't know if they're connected or not, but he wasn't able to get services on that day that he needed it, and with the most tragic consequences. So what helps is being able to explain how this impacts real people. They're going to be something like 40% of babies that are born, those healthcare costs for the birth, immediate, dealing with the birth of the child is paid through Medicaid. What are those moms going to do? What are those families going to do? Where are they going to go? And it creates risk for them, for their children. So having those kind of examples is really, really powerful.
I think the most important thing for some of these men and women, is that they want to win re-election again. And you have to make them fear the voter more than they fear Trump. That's it. And that's the only way. So the more you can go and talk to your friends and talk to your friends' friends, and you go and talk to some of these members of Congress and tell them, like, if you cut Medicaid to give money to the billionaires like Elon Musk, you're going to have electoral consequences. That's the only thing they understand. They think they have more power than you all combined in this room. They think that, they could lie to you and say, oh, we're not cutting Medicaid, we're cutting waste, fraud, and abuse. You're going to hear that over and over again. Don't fall for that, especially in Arizona, because we have Access. Access is one of the most well-run Medicaid programs in the country. In the country. It gets awards all the time for it, right? So when they come and start cutting, they're literally going to be cutting people off. And unless they understand and they feel the pressure from voters, Arizonans, that they're going to have electoral consequences to them gutting you to give more tax cuts to Elon Musk, they're going to do it. So talk to your neighbors, have your neighbors talk to their neighbors, and then reach out to your local congressmen, both Democrat and Republican, and tell them, like, you will not stand for this, and you will remember come election time, because that's what they want you to do. They want you to forget about it. They're going to distract you with something else, some audacious, bombastic thing that the Trump administration is going to do right after they cut Medicaid, and then they hope come November that they're going to distract you with something else, and that way you keep on voting them in. That's their plan. Just don't let them fulfill their plan. That's it. Not going that far.
Thank you, Candy.
Thank you. How about Stephen Sheets?
It smells like pizza.
Good afternoon. I'm Stephen Sheets, the President and CEO of Southwest Behavioral and Health Services. Thank you for this opportunity. Given the ongoing shortages of essential health workers in the behavioral health system, how do you plan to address the potential risks that policy changes to coverage and workforce funding may have on access to mental health services? And what steps will you take to ensure that people in need continue to receive that essential care without exacerbating workforce shortages?
Well, we're going to keep fighting for it. We've got a shortage in healthcare services across the country for a number of different reasons. When you think about those home healthcare aides, nurses in hospitals and clinics like this, we used to have immigration policy that was beneficial to our healthcare industry, especially from specific countries. Philippines is a good example of where we used to have a lot of nurses would come because we had gaps here in the system that we couldn't fill. Another challenge we face is in residency programs for doctors. The amount of money we spend on this, well, the money comes from Medicare to begin with. And the amount of residency programs since the 1980s has not grown substantially across the country. And we have a much bigger population now than we did 40 years ago. So as a ratio of doctors to the population, that number has continued to shrink. And now we've started throwing people out of the country. I don't know if anybody saw this in the news yesterday about a transplant doctor who was a lawful H-1B visa holder as a talented transplant physician was just tossed out of the country because she went and visited some relatives in, I think, Lebanon or somewhere, so thrown out without cause, without due process. So we're up against an administration that does not follow the rules, I think it's very fair to say, and in some cases are breaking laws. But we've got to do better. We've got to continue to make our healthcare system more efficient, and we've got to have the workforce. Otherwise, this gets spread so thin, and the delivery of services just starts to get worse and worse.
So, this is the thing that really annoys me about this whole conversation, is that think about how much better this country would be if we actually invested in our healthcare system instead of trying to cut billions of dollars more for billionaires. Like you're talking about we don't have enough doctors. You're right, we don't have enough doctors, because we don't have enough residency programs. And when Mark and I try to get more residency programs here in Arizona, you know what we get told? It's too much money. Well, somehow there's enough money to be found for tax cuts, right? But not enough for a residency program we severely need nurses, and whether they come from Philippines, Mexico, or anywhere else, we could also develop them here too. But some of the programs that we used to fund to create our homegrown nurse programs are also now being severely cut. It's also really expensive even to go to nursing programs. Colleges used to be more affordable. Now if you're going to go be a nurse, by the time you get yourself trained, you're going to come out of school with so much debt, it doesn't actually make sense for you to even go into nursing, right? And then for us that are in the VA, we already see how hard it is to even get nurses and doctors into the VA. And they're going to start cutting those people. Before this year even happened, the VA was severely understaffed in almost every department. Trying to find a therapist to talk to you in the VA sometimes is just in itself requires you to get therapy, right? It is so hard. And now you're pushing away people that are doing this out of the love of, for their country, and now you're cutting people, and you're basically telling them thanks for your service, goodbye. And when I say thanks for your service, the people that are doing work at the VA, they're listening to some really hard stuff. Hard stuff. You know what this country is doing to them? Most of them are veterans, giving them maybe a couple days notice, one last paycheck, and goodbye. They're kicked off of health care. They are basically told, you're on your own, no severance, nothing. How do we treat people like that are serving our veterans and then turn around and say, hey, come back and work for us at some other point? Because they're going to have to. There's no way that the population of veterans is going to keep growing, that we're not going to need more men and women to come back. Imagine how hard it's going to be for us to go get that doctor, that nurse, that therapist to come work for us after we just treated thousands and thousands, almost 80,000, potentially 80,000 employees this way. So for me, the point is that we're not following our values. If we really valued, good access to public health care, this is where we'd be investing it, not necessarily on these billionaires that really don't need it, won't even notice, by the way, this tax cut in the end.
How many veterans do we have in here today? Good number.
Wow.
Part of the Project 2025 plan was to means test veterans' retirement and disability. So if they get what they want, according to the plan, you could see retirement benefits cut for veterans and disability benefits cut based on what your household income is.
Yeah.
Forget about the fact that maybe you had your leg blown off by a landmine and you're disabled. So that's in their plan. On top of that, I think the number was something about 80,000 folks they want to cut from the VA that provide health care to veterans. That would be just devastating to the VA.
Oh, yeah.
How about Joe Whisker?
Hi, I'm Joe Whisker. I'm here with my wife today. The cut to Medicaid is going to be really hard for us, deep to us. We adopted our daughters through the foster care program, and one of our daughters who has highly special needs, and protecting her health care for her to develop, her to grow, the cost for us to be able to do that would be astronomical. And how are we going to protect those in the foster care system with this? And are people even aware of that? That's where we're going to hurt these kids that have already been removed from homes, that lost everything, and they really don't have a whole lot more to life to look forward to other than hopefully finding a good home.
Joe, I'm just so sorry you and your family have to go through this and even think about this. Adopting kids from a foster home, from foster care, we need more people like you stepping up to do that. And so I could say, I know you have another question there, but I will say, Ruben and I are going to fight to make sure this doesn't happen. We're going to do the best we possibly can. We need all of you guys in this room on our team. We need everybody in the back of the room on the team speaking out about this as much as you possibly can. We also need the press covering this. It's a really important issue. As Ruben mentioned, Donald Trump is going to do something else that we're going to think, wow, that was the craziest thing we've ever seen, like letting 1,600 felons out of prison. I mean, that seems like it was a lifetime ago.
Jesus.
So there will be other things like this. We've got to stay on top of this. We've got to fight this all the way to the end in the United States House and then the United States Senate. We can prevent it from happening, but it is going to be hard. Go ahead, ma'am.
I'm Joe's wife. I
Yes.
just wanted to.
I assume
say-
that.
Rose, why
So
would you
I
have
wanted
your
to
shield?
say our second part. We check all the boxes. Joe's retired from Navy, 23 years, Chief. We've adopted our children from foster care. Please don't. We've adopted our children from foster care. We work. We provide for our family. We contribute to our society. We volunteer in our communities. I disagree that this hasn't happened yet. The impact is now. On a micro level, we feel it now. Our daughter has severe special needs. You want all the boxes? Great. She has behavioral health issues. She actually has a rare form of diabetes that we had to fight, and Medicaid was able to cover to get her tested and diagnosed. We check all of the boxes. Now what? What do? We feel incredibly powerless trying to plan for our family. We can't wait until it's done. We need to know, how do we prepare for what may come down the hatch? We're trying to shield ourselves before we're wounded, and we don't know how. Would you mind telling your colleagues in Washington that when they're burning down this house, there's people still inside? My kid is inside.
I'm so sorry. I'm so sorry again. The most fucked up situation about this is that your daughter would actually have full coverage while she was in the foster care system by federal and state law, but because she found a caring family, she is no longer going to be automatically eligible for Medicaid. It's like, isn't it like kind of the perverse incentives that, healthcare while you're in foster care is guaranteed, and then outside, once you're out, then it's not necessarily, which is scary. It is now. What I'm saying, but if the cuts which to happen, that's the problem. And the instability you're talking about, that feeling of like, that you're feeling, it's the feeling that almost every parent has, right? Because all you want is security. That's what parents aim to do. They want to bring security and stability to their kids. I have two. I have another one along the way. And I think, last one on the record. Last one, I promise. I lost negotiations on the other one. But that's all you think about as a parent, right? Like, how can I bring stability to my kids? How can I bring security? And this thing is hanging over you, right? And the thing I think that annoys me and annoys Mark, he's also a father, is that this is unnecessary. There's nothing that is happening in this country that says we need to cut Medicaid, right? As I said, we can be a rich, prosperous country by taking care of those in need. It is possible. We've done it before. We did it in the middle of the Cold War. We did it during World War II. Somehow, for some reason, we have become somehow a weaker country that we can't do that anymore. I reject that. And also, the other thing we have to reject is that we're powerless. That's what they want us to believe. That's what Trump and his cronies want you to believe, that you're powerless. You're not powerless. You have a vote. Use that vote. You have a voice. Use that voice. The more we use it, the harder we fight, the more likelihood we have to coming out of this together. That's all. That's what we need to keep doing. I know it's hard. I know it's difficult to keep thinking that way. I think we would all love to be able to snap our finger right now and have that solution, but it's not going to happen that way. We have to fight them down. We have to grind them down to the point where they give up on this fight, because if you give an inch, they will take it all. They will.
Ma'am, what you just said was incredibly powerful. Believe me, you said when you were burning down the house, they need to know there are people inside. I am 100% going to take that back to my Republican colleagues. So thank you for that. What was your name so I could quote you? What's your? Tiana. Thank you, Tiana.
I may borrow that too.
Tiana.
Okay?
Thank you. Our last question from the audience is Jeffrey Zan.
Oh, what was it?
Hi. I was asked to speak on my personal situation. I'm on Medicaid. And I was reluctant to do so. But after hearing what some of the people here have said and thinking about it a little bit and hearing what you've both had to say, I think it can offer a different kind of perspective. I had to come here for family emergency. I've lived a lot of my life abroad in countries, all other similar countries that have universal health care. It's not a question about whether you deserve it or not. Everyone deserves it. I was going to go into details about my personal situation, but I think that's enough. I think I would rather ask the senators to be more straight with us, to work with us inside and outside. For example, when you say we need to try to convince the GOP leaders, we need to bring it back that there are people inside the house when it's burning down. Well, I'm sure a lot of people are familiar, I'm going to paraphrase, forgive me, Maya Angelou, but they've shown us over and over and over again, they don't care. They don't care if people die. They don't care if people suffer. We want you to be straight with us. How do we go to the next level to fight this if that's the case? And I know maybe some people here are so busy making a living that they're not paying attention, but some of us have been able to pay attention. So that's what I would ask you.
Yeah, so what is the next level, I think is what you're asking. And what was your name, ma'am? I didn't catch it.
Jeffrey?
Jeffrey. So Jeffrey, like what is that next level of being just pissed off about this and angry and getting out there where you're going to have an impact? So there are opportunities here in Maricopa County to get out in public and have your voice heard by making phone calls and sending emails. They really matter. You might not think making a phone call to a member of the United States Senate or House and leaving a message, by the way, because there are so many phone calls has an impact. But when the phone system shuts down in the U.S. Senate office buildings because so many people in the country are pissed off, everybody knows that. And by the way, they know what side of the issue they are on. Like my Republican colleagues, if we have a day when there's a decision coming up that's going to affect Medicaid across the country and the phone system shuts down, there are enough phone calls getting through that those senators, they know why these people are calling and what they're calling about. Whenever I walk into my office on a Monday, usually in the afternoon when I do my 10-hour commute from Tucson all the way to DC, it's one of the first things I ask the folks who are often interns, what are people calling about? And then we get statistics about what they're calling about. And I know it might seem like it's just one phone call among tens of thousands, but when those tens of thousands of people collectively are trying to have their voice heard, it does have an impact. Believe me, when my wife Gabby was serving in Congress, she used to tell me all the time about what people are calling about. So call, write letters, show up, at places when you can. Show up at your local congressman's office. Here's a good question for all of you. If you live in Andy Biggs' district, does anybody live in Andy Biggs? You're his neighbor? Or Abe Hamaday, or Paul Gosar, or Schweikert. There's four individuals. How do you think they're going to vote on this? Well, my guess is they're going to vote with Donald Trump on this to cut your Medicaid. You show up in front of their office. Tell them how pissed off you are and how bad this is for our country and how there are people inside the house that you are trying to burn down.
Yes.
Tell them that.
If you notice, they cut town halls, right? If you notice, the Republicans have cut town halls, and everyone's like, well, they're trying to protect themselves from people protesting. What they're actually doing, leadership, is trying to protect their votes. Because if they know how unpopular this is, they're going to lose that vote. And so if people are showing up at the office, going in there every day, respectfully asking for a meeting to talk about Medicaid, then they're going to start feeling that. This is why they're not having town halls. When I was a member of Congress, for those guys if you remember that, I used to have town halls all the time. The fact that members of Congress aren't having town halls is because they're trying to shield themselves. Talk to your friends, talk to the press, talk to every group you could be involved with. Go to where they are. If there is a town hall that's about whatever other issue, go there and bring up the issue, right? Yes. Yeah. Well, this is what our first one, but it's the first one. There's going to be more.
Jeffrey, I'm not going to tell you if it's enough or not. I do not know. We do not know how this is going to turn out.
You just got to keep going.
But I'll tell you what we can't do. We can't give up. We got to keep fighting all the way to the end. And there will be other elections.
I should give one more.
And elections have consequences. We're seeing the consequence of the 2024 election right now and how bad this can be. And there's going to be some continued bad decisions by this administration. I mean, it's going to...
We'll take a different... We're focusing on this right now. I would want to say one more thing because we have Spanish speakers here in the crowd, and then we have Univision Telemundo here and other stations. Por la población latina, especialmente los que hablan español, este mensaje es muy importante. Este programa de Medicaid y Access es para usted, para las familias latinas, muy importante. 37% de todas las familias en Arizona están en este programa. Este programa asiste a nuestras familias para ir al hospital, ir a los doctores, tener las medicinas que necesitan. Estos programas son importantes no nada más para las personas que están en pobreza, pero también las personas que están trabajando. Casi la mayoría de las personas que están en este programa son trabajadores, son dos personas con un niño o una niña que trabajan cada día, pero no tienen suficiente dinero para comprar seguridad privada. Este programa es muy importante para usted y su familia. Por favor, hable con sus congresistas cada día. Dígales, por favor, que no cortan Medicaid, acceso aquí en Arizona. Hable cada día hasta que ellos dicen que no van a cortar. Porque cuando si cortan este programa, el programa no va a regresar, especialmente aquí en Arizona. Por eso es importante que lo paramos ahora y hoy, que no cortan a Medicaid. Gracias.
Gracias. We have time for one more question.
It's 12:30 this morning.
My name's Dale Grace, and I'm here to thank you both for standing up for us. But I feel that not all Democrats are doing that. And I attend the rallies. I'm going to the Bernie event Thursday at ASU. And I feel like we need leaders here. And I appreciate what you're doing.
Look, I can't speak for everybody, but I know there's a leader to my right here. But we can do better, and we should do better. We owe it to every Arizonan. We owe it to the veterans. I think, this is, our attempt really to kind of start the movement, right? One of the negative things about being in session for 10 weeks, it's the longest time the U.S. Senate has not had a break to come back to home. For us, especially because it's a little further, it makes a big deal. It didn't allow us the time to start getting organized in this nature. This is why the first break we have, we're here. Tomorrow I'm going down to Douglas and I'm doing an event there, and then I'm going to Sierra Vista and doing an event there. This man has a private plane and flies everywhere, so God knows where you're going to go.
It's a small little airplane that
He wants me to go on the plane with him. It's not going to happen.
It's got 4 seats.
But this is how we start. We are going to make the moves, but leaders need to have people that are there with them, right? And you guys are the actual leaders. We're here to facilitate. And we're going to continue doing that, and we're going to continue to put pressure up where we can on the people that are really going to have to end up making this decision. We know where we are. We're not cutting Medicaid. We're not going to cut the VA. We're not going to screw over the poor to take care of Elon Musk and his buddies. You don't have to sell us. We're here to help you organize so we can make sure the people that have some decision-making power still, those 5 members of Congress here in Arizona or other parts of the country, hear you. Because if they hear you, and if they're logical, maybe they don't care about people dying, but maybe they actually care about their own jobs, maybe they'll actually do that. But we have to, and now this is the other thing. This is disheartening. I know everybody wants a short fight and a long victory. We need to keep pushing day in, day out, over and over and over again, and that's how we win in the long run. Thank you. That's it.
Thank you. And finally, and we can win in the long run, but I really want you guys to know, whether it's Jeffrey, Marcos, Piana, Joe, Stephen, everybody else who was here today, you guys, you're not powerless in this. I know it might feel like that, but if you're in this fight with us, we are in this fight with you all the way to the end. And just know that these guys on the other side, the ones that are on the side of billionaires and millionaires and the wealthiest Americans and the powerful people, there is power in numbers. And on this issue and so many other issues, whether it's veterans, health care, whether it's Medicaid, Medicare, we have the numbers on our side. So if we stick together and fight, we can win this fight. Thank you, everybody. Thank you for being here.
Thank you, Jerry.
Thank you. Back, or they